begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life, and I'd like to say welcome to part 2 of Acupuncture, COVID-19, and Lupus. Now in part 1, I'd given you a brief education on lupus and its symptoms. Now before I get into analyzing primary symptoms, as well as the progression of diagnosed patterns, from a Chinese medicine perspective of course, I'll spend a little time talking more about the seriousness of COVID-19 and lupus. I'll begin by reminding you guys that lupus is a chronic autoimmune disease, which, as I've stated, your immune system attacks its own healthy tissue, which then compromises the immune system's ability to fight off infections. Now, what compounds this reality is those that have been diagnosed with lupus tend to be on immunosuppressive drugs, which further compromises their immune system's ability to respond to infections. Now, pretty much in a nutshell, individuals with lupus are less able to fight off bacterial or viral infections. Becoming infected with this virus can possibly trigger a lupus flare. Studies show that infections are the second most common cause of illness and death for people with this autoimmune disorder. Now, individuals with higher lupus disease activity and lupus kidney disease, they usually take a much longer time to recover from infections. Now, this is because of the hyperactivity of certain immune cells that lupus causes, creating destructive antibodies, which is bad for their immune system. Now, it is extremely important for people with lupus to pay close attention for severe symptoms of the coronavirus, such as difficulty breathing, a feeling of pressure in the chest area, or a change of color in their face or lips. Now, if you ever find yourself experiencing these symptoms, call 911 immediately. Now, triggers for lupus flares vary from individual to individual. Key triggers include stress, exposure to too much sun, and certain chemicals that are in some foods. Now, if you know your trigger, please take extra precaution to stay aware, especially in a time such as this. Now, if you happen to become infected with this virus, work closely with your doctor until the virus passes. I say this because an individual with lupus may require hospitalization to avoid life-threatening complications such as organ failure or respiratory failure. Now let's get back to looking at things from an acupuncturist perspective. How would I treat an individual diagnosed with lupus? Let's analyze the primary symptoms of lupus from a Chinese medicine perspective. Now, when it comes to the more obvious symptoms, such as a butterfly rash on the cheeks, the face, if this rash is bright red, that indicates a heat sign. As an acupuncturist, I would have to differentiate as to if this is a result of excess heat or deficient heat. If the rash expresses itself in a rapid manner and disappears just as quick, this is a sign of heat toxicity. Now, if the rash expresses itself in a slow, gradual manner and goes away as such, an acupuncturist, or to an acupuncturist, that will be a sign of yin deficiency with empty heat. Now, if the butterfly rash appears as dark, appearing and disappearing slowly, then that would be an indication of blood stasis. And another primary symptom of lupus is fever. Now, if there's a persistent fever, that would be a sign of excess heat toxicity. A low-grade fever would indicate deficient heat. Now, if there's night sweating, let's say with a dry throat accompanying these symptoms, then that would indicate a complication of yin deficiency with empty fire. Now, another primary symptom would be joint pain. Now, if there's swelling and redness, let's say, and the joint pain is warm to the touch, that would indicate to me that there's excess heat. If the joint pain appears to move around whereby it just doesn't feel as if it's in one particular area, that would be a sign of internal wind. Joint pain that feels heavy is a sign of excess dampness. If the joint pain is severe and it's in a fixed position, that would be a sign of blood stasis. Now, joint pain with limited range of motion and intolerance for cold, with cold hands and feet, is a sign of spleen and kidney yang deficiency. Now, if there's edema, that would be a sign of failure of water metabolism. Now, depending on the stage in which it's at, that will determine if it's simply a spleen pathology or it involves the kidney. Whereas an individual with lupus would have pitting edema when they touch their lower extremities, let's say around the ankle or on the top of the foot, and the swelling would leave an indentation in the area touched. That's pitting edema. Now let's take a look at the 5 basic patterns of Chinese medicine. A diagnosed pattern can be excessive heat toxicity. Another can be yin deficiency with empty heat, and another can be constrained heat with congestive fluid. There can also be blood stasis with heat, and another could be spleen and kidney deficiency. Now, in my next episode on acupuncture, COVID-19, and lupus, I will go into symptoms that present with each pattern as well as pattern progression and how I as an acupuncturist would treat these patterns. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?